Have you ever asked yourself, why do your feet hurt? They might hurt a little bit or a lot. That doesn't matter. They are still hurting. They hurt when you go to shopping, when you go to the supermarket, or when you go to work. But why are they hurting? It could be diabetes. It could be a neuropathy. It could be the start of a condition that you can still reverse today. So in today's video, I'm going to reveal the most important reasons why your feet might be hurting and how to reverse this condition before it's too late. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to see notifications and be the first one to watch a new video. If you need an online appointment or quality supplements for your disease, visit drlandivar.com and stay till the end of the video. I share tips and video links related to this topic. Your feet should not be hurting. And we should think about this because if it were normal, then everybody, kids, adolescents, and adults at the same time would feel their hurt or their feet in pain. Now, curiously enough, when you're starting to see this condition or this pain at any point in your life, this may be a symptom of something that is starting to affect you. In some cases, it might be, for example, arthritis. It could be a diabetic response of the start of insulin resistance. Or it can even be a neuropathy, damage of your nerves in the distant part of your body that is still not getting enough oxygen or nutrients. In any case, you have to discover why your feet are hurting, and this way you can actually treat the cause instead of treating the symptoms. So in today's video, I'm going to reveal why your feet might be hurting and how you can reverse this terrible health condition. Number one, you might be starting with insulin resistance or starting a diabetic response. Not many people think of pain in their feet as something that could be starting as a diabetes or a pre-diabetic response of our body. You see, when your feet are hurting, this could mean that there is a problem with the circulation or the nutrient absorption of whatever you are eating to make sure that your nerves and your tissues on your feet receive everything they need. At some point, you might be hurting, maybe when you're standing for a long period of time, or you are out shopping, or maybe you are at a supermarket. That doesn't matter. The rate in which you are hurting could actually tell you that there is a problem, an insulin resistance, or a resistance to the tissue in the distant part of your body to being able to nutrify itself and make sure that pain is not appearing out of nowhere. Now, if you feel that your feet are hurting, I would definitely get something done about it. Make sure that you start exercising. Make sure that your insulin resistance at any point in your body is eliminated so that your feet and your tissues can receive all the nutrients they need so that they don't get damaged. My advice to you is to start changing your diet. Start eating more fruits and vegetables, less sugar. Make sure that your circulatory system is functioning. Start exercising and make sure that everything you are eating is actually nutrifying the distant part of your body. If you need something natural to combat insulin resistance and make sure that this pain in the distant part of your system is going away effectively, and so that it doesn't become a problem in the future, look for Appleizer, Green Shot, and Neuromatrix from Fineland at drlandivar.com. Number two, it could be a neuropathy. Neuropathy basically means that there is a damage to your nerves or nerve system. Now, a neuropathy is only diagnosed when obviously the condition is way past beyond pain. Neuropathies actually occur when there is a diabetic condition, when there is a chemical interaction that is damaging your nerves, and sometimes when there's poor circulation in distant part of your body. Now, you can actually see neuropathies start with small pains, maybe numbness, maybe even the sensations of burning sensations or cold sensations in parts where you don't really understand why it's happening. Neuropathies can appear out of nowhere, slowly but surely, and actually be a problem in the future if you don't treat it now. Now, if you're suffering from pain in any part of your body, burning sensations, cold sensations, and even worse, you already have a chronic condition like diabetes or pre-diabetes, I suggest you do something about it. This can actually be reversed if you're taking something now natural to make sure that your body can actually reverse this condition. Something like Neuromatrix from Fineland, for example, can help. Something that actually reverses or neutralifies your nerves to make sure that they can stop producing that pain you're feeling. If you need something natural for this purpose, look for CircuHealth, Neuromatrix, excellent by the way, and a multivitamin from Fineland at drlandivar.com. Number 3, it might be the result of poor circulatory health. Now, if your feet are in pain, if your hands are in pain, this could be the result of a poor circulatory health you might be having. This could be a plaque, cholesterol plaque you might have somewhere in your body that makes that all the tissues surrounding that part or in the distant part of where that irrigation should lead is actually dying off. Poor circulatory health can cause this. Even varicose veins can cause pain. And this all has to do with how your arteries and veins are responding to blood pressure, to the content in your blood, and how much cholesterol, sugar, triglycerides are circulating in your system. If you need good circulatory health, you obviously need to exercise. You need to change your diet. You need to reduce cholesterol levels, triglycerides. And you can do all this by changing your diet and making sure that inflammation is not becoming a problem. If you need something natural for this purpose to make sure that your circulatory health is actually healthy and you are free of varicose veins, look for Vein Flow on Cardio and Oxy Elixir from Fineland at drlandivar.com. Number 4, arthritis. Sometimes pain in your feet could be the result of arthritis. What is arthritis? Arthritis is basically what the name is implying. Arth, like arthritic, pain, itis, inflammation. Arthritis means pain or inflammation in your feet, in your articular joints. It could be only in your feet when it's starting, and sometimes could expand, always symmetrically by the way, always in symmetry, to both your hands, both your knees, or any part of your body. Now, if you are suffering from arthritis, there are many things you can do before things get worse. For example, reduce the consumption of proteins, reduce consumption of meats, of poultry, of fish. Too much protein will obviously make things worse. And on the other hand, reduce the consumption of inflammatory foods. Everything that has an inflammatory factor will make things worse. So for example, too many chemicals, too many processed foods, too many colorings and chemicals and stuff you are eating in processed goods can actually make matters worse. And at the same time, improving your kidney function. Your kidneys can help reducing the accumulation of all those inflammatory factors, but at the same time, obviously, help your body with a good diet. If you need something natural to reduce arthritic pain and make sure that your body can be helped by reducing the symptoms of pain in your feet and your legs, look for CircuHealth, Kidney Matrix, or Uriescence from Fineland at drlandivar.com. And help out the channel by giving this up and share with your friends and family. If you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or an online appointment, visit drlandivar.com and check out these other videos with this topic and information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.